Alrighty, so hi everybody. My name is Ashila Jawani. Today we are here for our health policy and advocacy training. The purpose of this training today is to go over healthcare and public health crisis advocacy. This is a two-part training. Today is part one, where we will be focusing on the intersection of public health and advocacy. And today is going to serve as an introduction to the advocacy work and how to pivot all that you have learned to be utilized in moments of urgency and crisis. Before we get started, I do want to take a moment to hold space for all the people impacted by the humanitarian crisis that is happening in Palestine and Gaza today. AMHP has published a sign-on letter. We're pulling together a toolkit. For those who are interested in advocacy work, we will be sharing that toolkit. We thank all of those who have participated in the relief work, and we definitely don't take this lightly, and we feel very strongly about continuing the humanitarian work in Palestine. As a healthcare organization, we feel very strongly about the humanitarian violations that are occurring, and we condemn any acts that impose collective punishment, displacement, genocide, war crimes, or violations of international humanitarian law. We work on domestic related issues. However, in moments of urgency and crisis, we do redirect our efforts to focus on the needs of our community, but in the form of partnerships. We recognize that we may not be the experts in all of the spaces, so we will partner with those who are experts, and we will refer you to organizations that are experts, and that is advocacy at its purest form. We don't need to reinvent the wheel, but we can bring people to the wheels that already exist so that you have access to the resources. A little bit about me as we get started. My name is Ashila Jawani. I am a nurse by training. My background is in global health. I have experience working in the pandemic relief space. I came into nursing with the interest in knowing that we need nurses in the public health policy and advocacy space. I believe we need more people who are in it, influencing policy and decision making, which is what brought me to this space to begin with. My work right now with AMHP focuses on the health policy and advocacy angle, and we'll get into that a little bit more. But today, briefly, as we go through what's going to be happening, this is the agenda. For those of you who like knowing what's a quick outline, go ahead and hold on to this. Again, this is just a brief little outline to kind of highlight what we'll be looking at. Again, the goal today is to look at what is public health, what does it mean to be a public health professional, and kind of understanding where advocacy lies with the intersection of public health. As healthcare professionals, advocacy is within our scope of practice. It just may not always be defined as such, but we're going to be talking a little bit more about the details of what that looks like today. So AMHP is a national nonprofit organization focused on fostering collaboration between Muslim professionals from diverse sectors of healthcare, seeking to advance public health, social justice, civic engagement within communities. AMP's core focuses are focused on mental health advocacy, and that mental health advocacy, health policy and advocacy for underserved communities, and professional development. AMP has emerged as one of the top 2 or 3 Muslim American organizations in the Biden administration, engaging to message and engage diverse Muslim and faith communities with shared healthcare interests. So we bring together healthcare professionals from all walks of life. Think you're outside of your RN, NP, MDs. We have everybody in the public health space, and we're using advocacy as a tool to influence policy making, policy change, and just legislation. In this webinar today, you're going to learn the many different ways to use advocacy, the many ways that I use advocacy as AMHP's Health Policy and Advocacy Manager, and ultimately using your voice and resources to call attention to a cause is the best start in the advocacy space. So today's objectives are going to be focused on how to be an advocate, break down what is advocacy, learn how to utilize public health and advocacy together, and then familiarizing yourself with the methods to support advocacy. Before we get into the details of Advocacy 101 and Government 101, today we're going to be looking at, of course, what it looks like to utilize advocacy in urgency And we have with us today Dr. Nidal and Dr. Karame from Doctors Against Genocide. We're so grateful that they're here. They're going to speak a little bit about their organization, but as a little highlight, Doctors Against Genocide. Are the slides looking blurry for everybody? I'm so sorry. Is that happening? I just saw that comment.
It might just be the icon is a little, it's okay.
Okay.
Their slides were okay overall. So it's
okay. Okay, cool. So this global coalition of healthcare workers is dedicated to succeeding where global governments have failed in confronting and preventing genocide, war crimes, and crimes against humanity. Their mission includes identifying, opposing, preventing, and eradicating genocide by uniting healthcare professionals in action. I'm very excited that they're here today to talk to us a little bit about their work, but they are a really good real-life example of what it means to take the tools of advocacy and how to mobilize in times of urgency. So I'm going to hand it off to the both of you, and then I will take it from y'all when you're done.
Okay. Thank you so much for having us. We really appreciate that. Thank you for describing our mission. And we are all about advocacy to raise and amplify the medical community to advocate against these crimes against humanity that can really affect health in a profound and severe way, more so than many of the medical conditions that we treat on daily basis. Our organization is very young, and I will hand it to Dr. Jbour to talk about some of how we started doing some advocacy and what we have been doing so far.
Thank you, Dr. Karame. Thank you, everyone, for being here. Thank you for inviting us. As Dr. Karame mentioned, our organization is very young. We are still navigating our way. We are still trying to learn how we can be more impactful. The seeds of the organization and the mission, actually, we had it for a while. For the last few years, we were thinking about it as a medical community. For some reason, we took the position of the backseat, that we wait as healthcare providers. We wait in our clinics, in our hospitals, and we wait for politicians to make decisions, stuff like that, and start wars for special interests, for whatever it is. And for the doctors and nurses and everyone in the healthcare industry to just wait and start treating the victims and the wounded and the injured and those people who are impacted by whatever crisis the politicians failed to prevent. So we thought that as a healthcare community, we should have a more proactive role to play in this. We should not be just sitting down and waiting to put band-aids on these crises and conflicts and injured people after the fact. We should try our best to have a voice and to have a seat on the table at the decision-making to prevent these crises before they do happen, if we can, and also to warn people whenever we feel there is some injustice going on, there is some racism, some dehumanization, some signs that there is something wrong that might happen, that we should warn for this. We thought that this is actually part of our medical mission as doctors, because even in traditional medicine, we learned that prevention is worth much more than intervention and treatment. And we thought that having advocacy and political voice as healthcare providers to prevent these wars, war crimes, crimes against humanity from happening in the first place is a preventive tool that we should utilize. There are so many healthcare organizations out there. They all chose, or most of them chose, the seat of waiting until the crisis happens, then they intervene and they provide aid, which is important, which is needed. We are not against that. But we felt that there is a vacuum, that as healthcare providers, we should intervene before, like we do vaccines. Why we come up with vaccines? Because we want to prevent the illness before it happens. Why we recommend people to do screening for cancer and for all kinds of health problems? Because we would rather intervene before, do prevention, and try to make an impact when it has better value, rather than wait for the problems to happen, then try to intervene when it is too little, too late. So that was the idea of the concept, and we thought we are going to organize it, take our time doing it and do it the right way. But unfortunately, the failures of politicians, whether here in the States or all over the world, made the mission more urgent. All what's happening now, all what we see happening in Palestine and many other places in the world, are due to the failure of politicians to do their job, which is to protect humanity. And what is going now, which is a textbook case of genocide in front of our eyes, 24/7 on the cameras, is a genocide in front of our eyes these days that we as health community should not stay silent about it. We should be very vocal about it. Our oath as medical providers says that we are there to do no harm and to prevent harm to others. And our core mission as a medical and healthcare community is to preserve life and protect life before it is sacrificed at the altars of politicians. And if the politicians were doing their job, we could have just, everyone stayed and mind their own business in their daily work. But because they failed, this means that we are the last line of defense for humanity, for children, to protect children's life from being bombed every day, 24/7, as we all see on the cameras.
Thank you. Thank you, Dr. Nadal. Yes, thank you, Dr. Karami and Dr. Nadal. I think both of you being here showcases again what it means to take the tools of advocacy and how to mobilize in times of urgency. And again, highlighting what it looks like to be healthcare workers and how advocacy is really rooted in our profession. Thank you for being here. And if anybody has any questions for them, feel free to message them directly. Going back to our purpose of today's call we're looking at what is advocacy, learning how to be a public health advocate, and familiarizing yourself with methods to support advocacy. While we go through that, I think a common distinction that is necessary to make is advocacy and lobbying. Many times when we discuss advocacy, people interchangeably use advocacy and lobbying. So advocacy is actions that seek to bring change and raise awareness on certain causes. I really want to bring to your attention the term raise awareness. And you are looking to address and educate on issues to call attention to root causes of the systemic problem. Lobbying, on the other hand, is when you are influencing specific legislation or policy through direct interactions with legislators. You have a direct ask associated with the topic at hand when you are meeting with legislators. So the clear difference here is if you are having a meeting and you are talking to somebody, if you are asking for support on something specific, that is then considered lobbying. Advocacy is simply informing, educating, sharing information that might be influential. However, lobbying, you are asking for influence. So a quick example, and this is very brief, it's very simplified. If I go in and I have a meeting with, let's say, a legislator, and I say, look, we are here to talk about HR 5008, the Health Equity and Access for immigrant families under the law, the HEAL Act. Can we count on your co-sponsorship for this bill? That is a clear example of lobbying. However, if I go into a meeting and I say, hi, my name is Ashila. I am here to talk a little bit about HR 5008. This bill looks at removing the 5-year waiting period that legal immigrants have to access federal programs related to healthcare. No ask, advocacy. Now, advocacy is not always lobbying. However, lobbying is always advocacy. because advocacy at its core is informing and educating and raising awareness on some issue. You are always lobbying with something in mind. And when you are lobbying for a certain issue, you are ultimately advocating for it too. However, when you are advocating for a specific issue, you're not always asking for support. That can be a little bit confusing. We can work through that a little bit more on a certain time if you want to message me to talk through it. But you're ultimately looking at understanding the issues and you're gathering all the facts. You're finding out for who you are advocating for and what you are advocating for. Are you advocating for a client, a patient, a group, communities, marginalized groups, a country? What are you advocating for? Are you advocating for a certain population? And who is it impacting? And what is the purpose? And then you're identifying the decision maker and what their motives are. So it's a three-part process, advocacy. Understanding the issues, getting all the facts, finding out whom you're advocating for and what you are advocating for, and then you're identifying the decision maker. Once you have all three of those parts, your advocacy is good to go. Now, because today is looking at the intersection of public health and advocacy, we're going to quickly go through the definition of public health. So public health improves our quality of life, helps children thrive, and reduces human suffering and saves money. This is from the American Public Health Association. This is the basic definition. Public health ultimately is looking at improving quality of life. Now, the next part of public health are public health professionals, and that's where AMHP comes in. So we are a group of Muslim health professionals looking to uplift public health policy for all Americans. Now, who are public health professionals? This can include government officials, business and nonprofit sectors. This can be public health professionals, restaurants inspectors, health educators, community health workers, scientists, researchers, nutritionists, community planners, social workers, epidemiologists, nurses, occupational health therapists, policymakers, sanitarians, first responders, anybody that influences healthcare and even the slightest or health outcomes can be considered a public health professional. Now, the quick difference between healthcare and public health. So healthcare industry treats people who are sick, while public health aims to prevent people from getting sick or injured in the first place. And then public health also focuses on an entire population, while healthcare focuses on individual patients. While lobbying plays a big role and lobbyists play a big role in influencing decision-making, there's a power in stories and human experiences. I, as a nurse, chose to come into the advocacy space because there's power in sharing what health outcomes look like from a personal level and individual level, because that's not always the key decision-making at the table. A lot of times in these spaces, you see a lot of lawmakers, legislators, people in the public policy space. But what we seem to forget often is that healthcare workers and public health professionals have a lot to say that can be influential from a different angle that is not normally included in the conversation. So in the case of, again, going back to public health, we need advocates from all areas to ultimately influence health outcomes, healthcare, and health policy. All policy is health policy, and we need people in all parts of the system to ultimately protect and uplift and prioritize public health outcomes. Yeah, the healthcare system is also considered a system. So people who are in the healthcare space, if you're in office, out office, inpatient, outpatient, whatever that looks like, that is still a system. Whether it's micro or macro, it's still a system that you're working with. A quick recap on the social determinants of health, and this kind of highlights where your advocacy can play into. So you have the social determinants of health essentially discusses what influences individual health outcomes, what influences patient health outcomes, what influences community health outcomes. Biology is only a little part of people's expression of health outcomes. So you have economic stability, neighborhoods, education, food, community and social context, and healthcare systems. All of these come together at play to influence individual community patient health outcomes. Where your advocacy can be is in any of these areas. Again, because we're highlighting this idea that all policy is health policy. You could choose to be an advocate for employment. You could choose to be an advocate for housing. You could choose to be an advocate in the literacy space, in the hunger space, in the community space, health coverage, looking at quality of care. You could be inside of the system or you could be outside of the system. It's all one big arena, just depends on where you are a part of. And ultimately, it's looking to influence patient outcomes, community outcomes, whatever you advocate for. If it wasn't for good housing, people could have compromised health outcomes. If it wasn't for employment, people could have no access to healthcare, which ultimately influences health outcomes. Another good graphic that showcases social determinants of health, and this is from UCLA Health. You're looking at, this is the breakdown. So again, kind of highlighting that healthcare is a small portion of your health expression. A lot of it is health behaviors, physical environment, socioeconomic factors, which compounded on top of each other influence health expression and your health care and your ultimate health outcomes. Again, this then ties into advocacy can be in any of these parts. Your advocacy can be focused on your expertise, what you feel passionate for, what your personal stories and experiences are rooted in. Doesn't always have to be traditional healthcare. And we'll talk a little bit about that in the next part of our training, Subtle Pitch, which is Thursday, about healthcare advocacy and the different areas of it and ultimately how it influences health outcomes. Alrighty, before we get into the nitty-gritty of what advocacy looks like and how to be an advocate and the tools of advocacy, we can't really do that without a primer in government. Now, I know everybody took government or has some exposure of it. If you live in DC, you're a part of it at all times. But a good government primer is helpful to better understand where your advocacy can be infiltrated into. We'll keep it super simple. There's three branches of the US federal government. We have the legislative branch, the executive branch, and the judicial branch. The legislative branch is the House of Representatives and the Senate, which is then known as the Congress. You have the executive branch, which is the president and the presidential advisors. And then you have the judicial branch, which is the Supreme Court and Federal Judicial Center. For the sake of advocacy, we are going to be focusing on the legislative branch because a lot of advocacy is directed at Congress, which then is made up of the US House of Representatives and the Senate, which ultimately is the legislative branch. We have three branches for checks and balances. Most of our advocacy, again, like I said, is done at the legislative branch, not to say it's limited at the legislative branch, but that's mostly where our direct efforts are. And again, like I said, this is Congress. So the United States Congress, you have the Senate, House of Representatives. The Senate is 100 members, 2 members from each state, 6-year terms. Re-election is split up so that we don't lose all senators at once, kind of keeps a little bit of a balance in the system. You have currently, it's made up of 49 Republicans, 48 Democrats, and 3 independents. The House of Representatives has 435 voting members. The number of members varies based on state population. So every state does not have the same number of representatives. 2-year terms. And currently we have 221 Republicans, 213 Democrats, and 1 vacancy. So when a legislation is introduced, a bill is introduced, it goes down one arm, then next before it has the chance of meeting the president. Normally, usually you see a legislation that's introduced on the House side or on the Senate side, but sometimes you can have legislation that's introduced together on both Senate and House, and that's called a bicameral legislation. So once a bill is introduced in the House or the Senate, the bill then moves on to the committee for debate and any amendment, goes back and forth. Bill is then voted on in the House or the Senate. Once it passes the chamber of Congress, it then goes on to the next chamber of Congress. So then once it's gone through the House, it'll now go through the Senate, again, introduced in the Senate, then moves to committee, debate, amendments, voted on. And then once it's passed on both sides, it goes to the White House, and then it gets decided on whether it's going to become a bill or if it's vetoed. Again, that was super simple, very easy breakdown. It's just helpful to see. You can never go wrong with a primer. A refresher is always nice. Sometimes I even need one. All right, so the next part of this training we're really looking at, we've kind of gone through government, we've gone through public health. Now we're highlighting some of the top priority issues that we see that stand out. This is data that has been collected from ISPU, looking at top priorities for Muslims in 2020. This highlights that we care about healthcare, the economy, social justice causes, immigration, education, foreign policy. Muslims do, and so does the general public. This is to highlight that there is room for a lot of advocacy. If we care so much about these issues, which is incredible, we also have the right to speak up and advocate for what we believe in. And as healthcare professionals or people in this surrounding area of healthcare, we can speak from a different area and a different level that showcases the impact from personal stories, patient exposure, work that you've done to really highlight the policies and advocacy that you care about. Again, this is looking at how Muslims are more likely than others to hold healthcare as a top policy priority. I know that not everyone on here might be a healthcare professional, but again, this is just highlighting that healthcare remains a top priority for all of us and a lot of us. And again, we've kind of looked at the Muslim voter aspect and now going into the next aspect of it, looking at the general voter population. This was a poll that was done by NPR. And you're looking at how overall we care about the economy, healthcare is top 3, immigration, climate change, crime. All of these are areas of advocacy. And I would argue that all of these areas ultimately impact healthcare and health outcomes in very direct manner. Abortion is split from healthcare. Gun policy is a public health issue. Climate change is a public health issue. Immigration is a public health issue. So all of these ultimately have the ability to impact individual health outcomes as well as community health outcomes. When you are looking for legislation to follow through, if you are looking to lobby or advocate for a specific piece of legislation, now small caveat, your advocacy doesn't always have to be legislation oriented. You can be advocating for a cause, for a belief that you believe in, and it doesn't always have to be associated with a bill or a specific legislation. The benefit of associating it with a specific legislation is that there is an action that has already been created. So let's say you believe in immigrant expansion for healthcare. So one of the bills that AMHP has been working on, we are on this rewrite committee for, is the Health Equity and Access Under the Law for Immigrant Families, which is called the HEAL Act, looking to expand access to healthcare for immigrant families who come into the United States. So because this bill already exists, and I believe in expanding healthcare for immigrant families, I believe in expansion for healthcare. I believe that everyone should have healthcare. There's a bill that already exists. So when I go in to do my advocacy and my lobbying meetings, there is already something there, and I'm asking for co-sponsorships. And again, on the next part of our training, we'll kind of break down what it looks like specifically for healthcare bills and what the terminology is. How would you do the language? How do you actually ask for explicit asks related to this? And all of you will get a toolkit after this with templates, but this is just a really quick example. Congress.gov is a wonderful, wonderful resource. Go to congress.gov, and when you go into the top left, you can change the setting to where you can see legislations from this Congress. So currently we are in the 118th Congress, and you can filter, you can track. So in this case, you can see that this legislation is introduced, and then if it passes House, passes Senate, it'll say all of that. You can see how many co-sponsors are here. Usually there will be a summary. It'll show you any amendments. Anything you need to know about this bill is on congress.gov. Again, to highlight, your advocacy does not always have to be legislative focused or bill focused. It can be surrounding a topic. It could be surrounding increasing certain things in your community. It could be around needs you see in your community. Your representatives are here for you, and they need to hear from you. They want to hear from you. Many staffers, and there's data that has been collected that showcases hearing from constituents and advocacy workers and community workers actually is very influential, because you are in the community. You can speak from your community lens, and that is so powerful. Go in, have those meetings, talk to people. However, if you have a legislation that you are supporting, a bill that you're supporting, that conversation has a direct ask link to it, and it can be fruitful in that way. This is an important resource, and we'll follow through with it a little bit later on too. All right, here now into the nitty gritty, which I think is what a lot of people came here for today. There are many ways for you to be an advocate. These are not just the 5. These are just some of the 5 that AMHP focuses on and works on. However, we don't want to limit it to this. I'm sure there's many other ways. We have engaging with Congress. And again, this is broken up in many different ways. You can be an advocate, you can lobby, you can be on organizations, think tanks, you can be on roundtables. Again, all of this engages with Congress in some capacity. You have community coordination, digital organizing, connecting with coalitions, and then research and publishing. And again, this can be broken down, number 5, into many different areas. And if you come to our training Thursday, you'll kind of get a little bit more of the details on that. The point of seeing all of these 5 laid out is not to say that these work in silo. In fact, otherwise, the more collaborative your advocacy is with each other, with the modes of advocacy, the more power it has. Similar to how we say there is power in number, there's always power in methods that you utilize. Digital organizing is an interesting one because we'll break it down, but we saw this come up a little bit more so in the pandemic and in the 2020 election, is looking at digital organizing. Many of us live on our screens. Many of us are very digitally engaged. Well, that coupled with everything else that you do has such power because it's in front of you. But again, engaging with Congress is great, but you want to also research and publish what you're saying. You also want to put it out onto social media so that people who may not be in your direct loop can also see it. But you also want to work with your community and see what their needs are. Ultimately, you really want to look at collaboration with people and in methods. Okay, breaking down the first part of our advocacy method, engaging with Congress. So first, step 1 is you're going to find the member of Congress you want to meet with. Typically, if you want to meet with your representative or your senator, that is a great start because you are a constituent, so you will always have somebody to connect with. For example, I am from Georgia. My senators are Senator Ossoff and Senator Warnock. I am meeting with somebody, it is very great for me to say, look, I'm from Georgia, kind of, bounce off some pleasantries related to that, highlight that it's my home state. It establishes a good framework and a sense of comfort in your advocacy in your meeting. Takes away that extreme stiffness and helps establish similarities. And if you're not meeting with somebody that is from your home state, you can always look them up, and we'll talk about this again a little bit later in the deep dive. Find commonalities, find things that you align with, even if it's voting records, policies, little things always help create comfort. So you're going to find your member of Congress, and for that, you're going to look on house.gov and senate.gov. Then you are going to contact your member of Congress, and you can call this number and set up a meeting with their staff. They will send you to the direct office, and then you can make a clear ask to the member. So this quick phone call method is for quick advocacy. So this is, for example, if you want to ask for, there's something going on, this is an urgency call, and you want to set up quickly an alert system. For example, I will call the office of Senator Ossoff and say, hi, my name is Ashila. I am calling on behalf of X issue. This is my personal connection to it. I am a healthcare policy and advocacy manager with AMHP. I ask that you do not support this legislation. Thank you for your time, and I will follow up with an email. This is a quick call. And again, this helps to kind of get it out there when there's storms happening with issues on hand, when you're looking for urgency and advocacy. These phone calls are very, very important because they keep ringing in the office. And I guarantee you, if you're doing it, other people are doing it too. And it helps bring an issue to the front of the table for the office and their staff. This can also be used to set up a meeting with the office. However, I encourage you all to email the staff. And again, we'll talk about this a little bit later, but that will help to have an in-person meeting. This is more so for a quick ask, quick alert. When you are calling the Congress office or you are looking to set up a meeting with the staff, more often than not, it will not be with the Congress member. And I'm not saying that to turn you down or to redirect your attention, but this is because the Congress person is made up of their staff. And their staff includes all of these people. You have the chief of staff, the legislative director, policy advisors, legislative assistants, correspondents, schedulers, comms directors, press secretaries, assistants, staff assistants, and interns. All of these people are equally important. These are the people that your Congress member is going to be going to get information. Every interaction is so important. And these are the people that will help you with your relationship building. Sometimes staffers move office to office. Sometimes they're in and out of the system, but you will always have that network and connection that will help you establish a relationship, whether it's with this office or the next, or help you out in any other ways. It would be amazing if we could always get a meeting with a Congress member. However, more often than not, they're busy, they're not in office, they're in their home states, they're going back and forth, whatever that looks like. However, any meeting you get with any of these people are equally as important and influential. They are heavy, heavy decision makers in these spaces and are critical for your success in relationship building. Ultimately, the goal is relationship building and networking. You may or may not always get a co-sponsorship or a vote, but you will always have this network that you build, and you can always tag team them. You can always rely on them, lean on them, whatever it looks like. They may be able to give you an inside scoop on something, but they will always be in your network. Never underestimate the power of the staff. In fact, if you can get a meeting with any of these staff members, it is considered a win, and they are equally as influential in these spaces. Because your Congress member has direct access to them and may not have direct access to us at all times, and they will be able to pass on everything that you said. Again, super, super critical. Now, when you are engaging with Congress and you set up a Congress visit, this is kind of how the progress should be broken into. You will have your pre-meeting work, during your meeting, and after the meeting. This is a lot of what I do on my day-to-day right now. These are the advocacy and lobbying meetings that you typically hear about that are very important and also are done with the staff of the congressperson, not always the member, the representative, or the congressperson or the senator. So before you meet with the person you are scheduled to meet with, you will send an email, and you will send an email to the scheduler or the health policy person that you have data from or the contact of, and whoever that person is that's who your meeting is set up with. You're going to conduct research on the Congress member, find out what their voting record is, find out where they stand on the legislation you're advocating for, or the policy that you're advocating for, or the issue that you're advocating for. Look at any committees they're a part of. Look at whether they're already co-sponsored on certain bills. You can find all of this on congress.gov. Prepare any material that you plan to share. Be familiar with who you're meeting with. Do not act surprised when you get in there and be surprised that you're not meeting with the representative and that you're meeting with the staff, because the staff is so, so important. Any tools, any resources that you want, make sure you have a one-pager so you can leave them with. They will always read them. They will always have it on hand, and maintain a flexible attitude. Sometimes, just because of how the schedule on the Hill is, your meeting may not be as long as you planned, or it might have to get changed. Or if it's in person, it might get moved to virtual meetings. That is okay. Things happen, and you want to be flexible, because ultimately that meeting is so, so important. When you get to the meeting, introduce yourself, provide a little bit of a background of why you're here, create comfort in the meeting. Now, this is the find commonalities, find things in similar, find any connections that you might feel connected to or feel like might be beneficial. You essentially want to break that wall that's there and create this sense of camaraderie and support in this space. Engage in dialogue and learn more about the staff. So when I go in, I quickly give a little bit spiel about me. My name is Ashila, my background. I'd love to hear more about you, your background, your work with the senator, and your journey here. And they'll tell me a little bit about who they are, what their work has. It kind of helps me figure out where their expertise is and what their work history with the representative has been. Then you're going to brief the staff member on the specific issue, your organization particularly, and what you are here advocating for. If this is a lobbying meeting, then you will state your explicit ask, and then you will ask for ways to support the congressperson after your ask has been stated. So for example, can we count the congressperson to support co-sponsor HR 5008? I'd love to follow up. If you have any questions, I'd be happy to answer them. I will be sending you an email with all of this information at hand, and then we can circle back and chat more. They'll probably say, okay, would love to get back to you. We'll review this material. And then after that, I want to say, we'd love to continue this relationship with this senator and the senator's office. Is there any work that y'all are doing, any legislation that you're drafting, any work that you're looking at that we could be beneficial for, that we could support you all on? We're a part of a lot of coalitions, a lot of networks. We'd be happy to share the work that you're doing and bring in some support. And then they'll say, oh, actually, we are working on X, Y, and Z. Again, this kind of creates this mutually beneficial relationship and establishes this networking scene between you and the staff there. After the meeting, you want to thank the member and the team, restate your ask, share any resources and information, and request a follow-up meeting. You're going to do this all via email. I recommend within the next day or two sending an email including all of this and saying thank you for their time. You enjoyed meeting with them, kind of recap the meeting a little bit. If there was anything fun and personal stated, go ahead and give that in. But again, you want to make sure that they hear from you, because this is the relationship that is going to be very handy going forward. The next method of advocacy is community coordination. So besides federal advocacy, we also have grassroots advocacy. There's power in community, and movements start from the ground up. Horizontal leadership and movements cause change, and community coordination highlights the power in those stories in the community. Your key stakeholders plus the community you are a part of adds power to the movement. It creates a sense of personal and personality. It adds personality to the movement. It shares stories. You can really speak from a more personal level, and your community can seem to connect to that. Typically with mobilization efforts, while strategy can differ, the ultimate organization and the intention remains the same. You'll still be doing research. You will still be focusing on direct asks. You still will reach out and connect with certain offices. The avenues may be a little bit different. So breaking it down into these 3 steps, you're first going to survey your community. Take the time to identify what issues are important to your community, where they stand, what everyone believes in, what's going on, what is the issue at hand that you are looking to advocate for right now. Get a sense of pulse on it. Then you're going to identify the key stakeholders. This looks at, advocating for, but looking at people who are in the community that have strong beliefs about this, people who are leaders, people who are change makers, local government officials, local community leaders that are valued, and impacted individuals. You really want to identify these key decision makers and key stakeholders to couple with the beliefs of your community, because these are people that are valued, and these people have experiences to share and also resources to share. Ultimately, combining the community and the stakeholders will allow you to begin your mobilization efforts. So the mobilization effort you choose to focus on can differ based on the specific issue at hand and how you choose to get and maintain attention. So this can vary from a protest, a petition, a town hall, virtual meetings, briefings, whatever that looks like. Again, will vary based on the need of the community, the need of the issue, and the severity of the issue. Whether or not you're looking for immediate attention versus if you want to take some time to plan it out will vary on the efforts that you are investing in. Again, to highlight, the intention will always remain the same. You're still going to be doing the same prep work that you would otherwise, just the method of exposure may differ in how the presentation is. The next method of advocacy that I kind of touched on a little bit briefly is digital organizing. Digital organizing is a fun one because I don't think it needs to work in silo, similarly to all the other ones. It's about building momentum and capacity to create and maintain movements. So digital presence can include email outreach, texting campaigns, virtual town halls, sharing and posting on social media. It can be social media storms. And you'll see a lot of these if you join any coalitions, which again, we'll be sharing out some of these resources after. They will often say, okay, today is a social media storm day. For example, we are looking at open enrollment just started. We'll be sharing a lot of information on how can you sign up for health insurance? How do you renew your health insurance? What is open enrollment? What is the deadline? And a lot of us who are in these coalitions will choose to post on a certain day to overwhelm our social medias with this information so that it doesn't get missed. But again, social media is at the forefront of a lot of our policy and advocacy work right now because it has a power of numbers. A lot of people have access to this that may not always be able to meet in person or go to advocacy meetings or go to lobbying meetings. But social media is a tool that can be utilized, and when integrated with everything else, has the ability to influence and impact many more than some of the other strategies can. There was a 2020 campaign. Maureen Turner led a successful campaign to become the first publicly non-binary elected official in the United States and the first Muslim member of the Oklahoma legislature. Her campaign used Impactive, which is a digital organizing platform, to mobilize voters for their win. Volunteers for the campaign sent peer-to-peer text and friend-to-friend text and facilitate conversations with over 10,000 people, which played a key role in securing her victory. So I think we saw a lot of this in 2020, especially in the era of the pandemic, and a lot with the election work, the impact of digital organizing. And you're seeing it right now too, with a lot of advocacy work for humanitarian relief, calling to action for ceasefire. You're seeing everybody utilize their social medias to highlight what is needed and what is necessary and where they stand. The next method of advocacy is research and publishing. So your voice is important. Lived experiences carry weight. You plus evidence, so your story plus any evidence equals an op-ed, your opinion piece. You're utilizing this to write a clearly defined topic with your unique voice, which is grounded in research. Typically, you're stating your thoughts and opinions and ideas in a very succinct manner. You're going to research your healthcare advocacy topics so that your ideas and opinions convey a well-supported argument that is both current and relevant. You're including an opening paragraph to engage the reader, paragraphs to kind of recap the issue, and then calling to action what is needed. This is a very professional manner to go about, of course, and has the ability to engage a different audience, intellectuals. It has the ability to get outside of your traditional norms and get into the spaces of many different professionals in health policy and advocacy spaces or other spaces that you might be a part of. Again, this is another avenue that can be used for advocacy. You can send these to members of Congress. You can have these for your town halls. You can also use these for your social media storms and digital campaigning, because you're utilizing what is your story and where you stand on a certain issue, backed with evidence to showcase something. And those are the two most powerful things you can have. Your voice and your story are extremely relevant when it comes to advocacy, because advocacy is rooted in self and it's rooted in why you believe what you believe. And a lot of times people know the facts, people know the evidence, people know the data, but hearing your personal experience is what can be that shift between a vote or between a belief, because they can associate something that is happening to a person and on a personal level. Now, we're going to spend a little bit of time talking about advocacy in moments of urgency. We've talked a little bit about what advocacy looks like on a grand scheme of things. We've looked at different ways of advocacy. We've looked at how you can be an advocate, the difference between advocacy and lobbying. But what happens when we're in moments of urgency? It speeds up that process. You don't always have time to break down, have those deep conversations, map out a strategy in a way that you might have otherwise, but you can expedite it in a way that honors the work that you've already done. You want to establish a network. Find the people who you believe will support you and will support the work that you're doing in the way that you feel like will be impactful. Reach out to people in your communities, your professional networks, to establish this group right away. You want to consolidate resources, sift through links, tools, learning resources, learning materials that may be helpful to reference, so that everything you're doing is rooted in fact and evidence. A lot of times in urgency and moments of crisis, the first thing people want to attack is facts, because that's the easiest thing to break down. Make sure your work is evidence-based and is rooted in research. You want to ensure that the team is confident in the material. That is going to back everything you do, and you want to make sure that that is solid. Connect with experts. Learn from the experts. Lived experiences are so valuable, and people who have spent years studying these conflicts and this crisis should be utilized as a tool. You do not have to try to reinvent the wheel. Support the existing agencies that are already in these spaces, amplify them, connect with them, partner with them, see how you can support them, but stay confident in your expertise and your skill set, and partner with those with other expertise and skill sets. In moments of urgency, we don't need to reinvent, we don't need to restart, we don't need to create something new all the time, but we do need to partner and empower, and that is so important. When you're mapping out a strategy, think about what works in a more timely manner, what is more efficient. Can you create a toolkit, write up letters of support, op-eds, action alerts, social media posts, anything that you can get out right away is important. Host learning sessions or town halls, call and email your representatives. This goes back to those urgent calls and calling the offices of your senators and representatives. So AMHP is a really good example here in looking at advocating in urgency. So as a domestic organization, our expertise is not always international work. However, we do understand that domestic work influences international work, and that as a healthcare organization, we have we also need to be speaking up and working on moments of crises. For example, right now, the humanitarian crisis that is happening in Palestine and Gaza. We wrote a letter of support. We consolidated a toolkit. We're hosting a training today to offer tools of advocacy that people might be able to use in spaces that they feel connected to advocate in. Individuals working in the public health space and healthcare workers are rooted in a unique position where your experience and personal connection serves as a great influence in shaping opinions on humanitarian issues. We're able to speak from a scientific, biological, systemic, and patient perspective. There was a Time article that stated, right now, we as healthcare professionals cannot be neutral and we cannot be silent. We must use our position as experts in health and human life to pressure institutions. Again, as healthcare professionals, we understand spaces in a more different manner, but I also know that I may not have the legal tools to support in this advocacy. So we're going to partner with other organizations and utilize them as resources. Our toolkit utilizes resources and links from CARE because they're experts on the legal manner. Organizations to learn more about humanitarian efforts, you can go to Imana because that is their expertise. But we're realizing and we're learning that we can partner with organizations and provide the sense of power and uplift organizations that have the resources and learn from them and also support them while utilizing their resources and sharing it out into our network because our network is also very vast. So when it comes to advocacy and urgency, not much changes except for the fact that it speeds up and you want to find the people that you can work with. You want to find the resources that you can work with, and you want to find the experts that you can learn from and work with. When it comes to advocacy, we know it's personal. We know we're all doing this for a reason. So find communities, stay grounded, find moments that allow you to have peace and protect yourself because we need you. Y'all are all very important in the work that we do. Our advocates also need to be prioritized. So take the time to do the things that you need to find peace and comfort because y'all are very, very important to us in the work that you do. That is all for us. These are ways you can stay connected. And our next training is Thursday, where we'll be diving a little bit more into the healthcare work and exactly what that looks like from a policy and advocacy standpoint.